What if a single infected tooth could actually kill you? Let that sink in. No antibiotics, no dentist down the street, no painkillers waiting in a cabinet, just an infection, slowly spreading, with nowhere left to go but deeper into the body. For ancient humans, dental problems weren't a minor inconvenience. They were a genuine, sometimes fatal medical emergency. So how did ancient humans actually deal with this? How did they remove a tooth? Thousands of years before modern dentistry existed. The answer is more advanced and more painful than most people expect. Think about this. Teeth don't just cause pain when they fail. An untreated dental infection can spread into the jaw, into the bloodstream, and eventually become life-threatening. Let that sink in. Archaeological evidence shows ancient humans understood, on some level, that a failing tooth needed to be dealt with directly. Ignoring it wasn't a survivable long-term option. Number 1. The evidence goes back much further than most people assume. Think about this. At an archaeological site called Mehrgarh in modern-day Pakistan, researchers discovered something remarkable: human teeth, dating back roughly 9,000 years, showing clear evidence of deliberate drilling. Let that sink in. This wasn't accidental damage. The holes were precise, consistent, and clearly intentional. Think about this. This means ancient humans were performing dental procedures thousands of years before anything resembling written history even existed. Number 2. The tool itself was surprisingly advanced. Let that sink in. Researchers believe these ancient dental drills were operated using a bow drill technique, the same basic mechanism sometimes used for starting fires. Think about this. A pointed tip, likely made from flint, attached to a spindle, spun rapidly using a bow-like tool pulled back and forth. Let that sink in. This created enough rotational force and speed to actually bore into tooth enamel, one of the hardest substances in the human body. Think about this. This required serious skill. Too little pressure, and the drill wouldn't work at all. Too much, and the entire tooth could shatter, or the surrounding jaw could be seriously damaged. Number 3. But drilling wasn't the same as full removal. Let that sink in. For less severe issues, ancient humans may have used drilling to relieve pressure from an infected tooth, essentially creating an outlet for painful buildup inside. Think about this. But for a tooth too damaged to save, complete extraction became necessary. And extraction, without modern tools, was an entirely different challenge. Number 4. Extraction relied on leverage, not precision. Let that sink in. Evidence suggests ancient humans used simple tools. Sharpened stone, bone, or wood, wedged carefully between the tooth and gum line. Think about this. Using controlled force and rocking motion, a practitioner could gradually loosen a tooth from its socket. Let that sink in. This wasn't quick, and it certainly wasn't gentle. The process could take significant time, effort, and repeated attempts. Number 5. Pain management existed, but it was extremely limited. Think about this. There was no modern anesthesia available, but evidence suggests some ancient cultures used certain plants with numbing properties. Let that sink in. Specific plant extracts, chewed or applied directly to the gums, may have provided partial, temporary relief from pain. Think about this. This wasn't reliable, consistent pain relief. It was a small mercy in an otherwise brutally painful procedure. Number 6. Some cultures went even further, filling the resulting gap. Let that sink in. At a site in modern-day Slovenia, researchers discovered a tooth, dating back roughly 6,500 years, filled with beeswax. Think about this. This suggests ancient humans weren't only removing damaged material. In some cases, they were attempting to seal and protect a tooth after treatment. Let that sink in. This wasn't crude guesswork. It shows a genuine, practical understanding of protecting a vulnerable area from further damage or infection. Number 7. But not every tooth removal was about disease at all. Think about this. Archaeological and cultural evidence shows some ancient societies deliberately removed healthy teeth for entirely different reasons. Let that sink in. In certain cultures, tooth removal or modification served as a rite of passage, a mark of adulthood, status, or group identity. Think about this. In some regions, specific teeth were intentionally removed during adolescence, signaling a transition into a new stage of life within the community. Let that sink in. This wasn't medical treatment. It was cultural practice, deeply tied to identity and belonging. Number 8. Other reasons were tied to grief and mourning. Think about this. In several ancient and more recent traditional societies, tooth removal was documented as part of mourning rituals following the death of a close family member. Let that sink in. This practice served as a visible, permanent marker of loss, a physical sacrifice representing genuine grief. Think about this. Pain, in this context, wasn't something to avoid entirely. It was, in some cultural frameworks, part of the meaning behind the act itself. Number 9. But regardless of the reason, risk remained constant. Let that sink in. Every extraction, whether for medical necessity or cultural practice, carried a real risk of infection from the procedure itself. Think about this. Without sterilization, without understanding of bacteria, the very act meant to solve a problem could sometimes introduce a new, equally dangerous one. Let that sink in. This is likely why not every attempt at ancient dentistry succeeded. Skeletal remains sometimes show evidence of failed procedures, infections that continued to spread despite intervention. But wait, who actually performed these procedures? Think about this. Evidence suggests certain individuals within ancient communities developed specialized skill in this exact kind of work. Let that sink in. This wasn't performed randomly by just anyone in the group. Certain people likely gained experience, practiced technique, and became trusted specifically for these procedures. Think about this. In many ways, this represents one of humanity's earliest forms of specialized medical practice, not a formal profession in the modern sense, but a recognized skill, valuable enough that others sought it out when needed. But wait, how would an ancient practitioner even know a procedure was necessary? Let that sink in. Without X-rays, without modern diagnostic tools, practitioners likely relied entirely on visible and physical signs. Think about this. Swelling, discoloration, visible decay. The patient's own description of pain and its location. Let that sink in. This required careful observation, built through experience treating many different cases over time. Diagnosis wasn't scientific in the modern sense, but it wasn't guesswork either. It was pattern recognition, refined through repeated practical experience. But wait, the instruments themselves required careful preparation. Think about this. Flint tools used for drilling or extraction needed to be shaped with precision. A dull or poorly formed tool could make an already difficult procedure significantly worse. Let that sink in. Toolmakers and practitioners may have worked closely together, ensuring instruments were sharp, appropriately sized, and suited to the specific procedure required. Think about this. Even something as simple as a stone tool represented careful craftsmanship, directly tied to medical outcomes. But wait, recovery after a procedure carried its own challenges too. Let that sink in. Without modern wound care, without antiseptic treatment, the period following an extraction was almost as risky as the procedure itself. Think about this. Some evidence suggests certain plants with natural antimicrobial properties may have been applied to wounds following extraction based on generations of practical trial and observation. Let that sink in. This wasn't guaranteed protection, but it represented an attempt, based on accumulated knowledge, to reduce the very real risk of infection during recovery. But wait, children face this reality too, in a different way. Think about this. Baby teeth naturally loosen and fall out during childhood development, but ancient caregivers likely still needed practical knowledge about when a loose tooth was simply developmental and when it indicated a genuine underlying problem. Let that sink in. This distinction mattered. Treating a naturally loosening baby tooth the same way as a seriously infected adult tooth could cause unnecessary pain or unnecessary risk for a young child. Think about this. Passing down this kind of practical medical knowledge from experienced adults to the next generation was essential for the community's overall well-being. So how did ancient humans remove teeth? Through remarkably advanced tools for their time, including precise bow drills. Through practical extraction methods relying on leverage and careful technique. Through limited but genuine attempts at pain relief using available plants. And sometimes, not for medical reasons at all, but for identity, status, and grief. Think about this. Long before modern dentistry, anesthesia, or any understanding of infection at a microscopic level, ancient humans were already solving one of the most painful problems a human body could face. Let that sink in. Not perfectly, not painlessly, but with genuine skill, careful technique, and a level of practical medical knowledge that continues to surprise researchers today.